Dr. Crayle, people talk a lot about sealants, and I guess it's mainly for the younger people, but I have also heard that, teenagers and even adults are having them, and yet that not necessarily everybody needs them. Tell us about sealants, what they do, and who should have them.
Okay. Yeah, sealants are a great way to prevent decay, especially for those at risk for decay. And those at risk are usually youngsters who are just starting to get their permanent teeth, and perhaps teenagers, typically who like sweets and eat some maybe a little more sweet than they should, and maybe they're not the best yet to in terms of brushing their teeth regularly. Sometimes some people have teeth with more little grooves and places to catch food particles, so they're more at risk for decay. And sealants are an excellent way to prevent many kinds of decay from happening. So,
how long does a sealant last once it's put on, more or less?
Normally they can last for a few years. Sometimes they last for many years.
Okay. Now, so once a person has, so basically you said grooves, basically in the tooth, some teeth, almost like a rock, they're more rough, they have more grooves, and if they have that, food can get stuck in it, and cavities can grow faster, and the sealant is supposed to basically seal that off. Is that if a person has a very, very smooth surface on his teeth, he might not need sealant. Is that what or might not need it as much?
That's correct. Yes. We look at the shape and the form of the teeth. That's part of it. We also look at the tendency for that particular individual to get decay, and then we make a decision whether we recommend the sealant, maybe for some teeth, not necessarily all the teeth, or maybe not at all.
Okay, got it. Now, a sealants for baby teeth, for the second teeth, and should adults also get sealants? Or, if they have them the first time and a few years later they are worn out, should he replace the sealants? Does it depend on something? What's the deal there?
Yeah, generally speaking, adults are much less likely to need sealants than children. It depends. When we look at a mouth, we see what is their risk of decay. There's dietary factors, hygiene factors, and like I said, the anatomy of the tooth, and we put that together and decide if the sealant would be a good idea for that particular situation.
Got it. What about baby teeth? Are you ever putting sealants on baby teeth or not?
Not as often, but occasionally we may. If we see decay just starting and it's not quite enough for filling, but we suspect it's going to continue, sometimes we can seal it to prevent the need for filling later. Yes.
All right. Well, again, thank you very much. So sealants overall are a pretty good thing to avoid cavities, and by doing so avoid, of course, toothaches, fillings, and all kinds of, those normal dental problems. So it's a good preventative thing.
Absolutely. Yes, it is.
Thank you very much.